Good day, South Africa. South Africa's National Health Act number 61 of 2003's Chapter 3, Section 21, subsection 2E, isn't wavering in its instruction, which states that, quote, subsection 2, the Director General must, in accordance with National Health Policy, E, coordinate health and medical services during national disasters, unquote. Last week's unnecessary unrest and looting resulted in increased pressure being applied to our nation's healthcare centres, which are already dealing with the rising COVID-19 induced admissions, especially in the KwaZulu-Natal and Gauteng regions. The situation has become extremely volatile to the point where it prevented nurses from going to work and even to their homes, as one was reported to have had their car stoned by protesters, while public transport services were also stopped from operating. With our country facing the deadliest third wave of the COVID-19 characterized by a rapidly spreading Delta variant, this looting episode heaps an additional burden on our already strained hospitals and will push them nearer to their buckling point. Looking closely at our healthcare centres' conditions before the outbreak of this most fatal COVID-19 epidemic gives us a sense of the horrific reality that we are now engulfed in. In the month of May in 2017, the Gauteng Health Department reported delays in the functioning of our hospitals, with the Charlotte Maxeke Johannesburg Hospital, or CMJH, and the Helen Joseph Hospital having unattended serious ailment patients waiting lists of 2,995 patients and 1,478 patients, respectively, with these numbers on a growing trajectory. Another dilemma that the Gauteng Health Department was in 2 years before the onset of COVID-19 was indebtedness of this department of 34 million rands to over 100 non-government organizations, or NGOs, which was caused by delays in payments, which in turn caused the en masse death of over 100 mental patients at the Life Esidimeni Hospital. On the very year of 2017, the CMJH was a contributor to the thousands of babies who died at birth in the Gauteng region's hospitals, out of which 13% had been from hypoxia, while 27% had not been adequately explained. CMJH's facilities at the time were in a condition of squalor, highlighted by leaking roofs that led to some quarters being left unusable. A year prior to the arrival of COVID-19 to our shores, the Telemachorano Hospital, or TMH, was in a state of being overcrowded and saw the need to transfer its excess patients to other health institutions, while at the same time the hospital had to try to prevent spreading the contagious nosocomial Klebsiella bacteria infection it was a subject of to other health centers. The irony of the current happenings causing a halting in the COVID-19 vaccine rollout programs, including testing and the treatment of patients in general, is that the looters are said to be doing it in order to convince the Constitutional Court to free former state president Jacob Zuma from prison. The mass deaths of babies and mental patients which occurred between 2015 and 2017, including the shortage of incubators and respirators at our hospitals, was all happening while former President Jacob Zuma had launched Operation Phakisa, which aimed to use the National Development Plan, or NDP, by including the local community of Johannesburg in the building and improvement of their health facilities, yet the opposite state persists. Jack Bloom, Gauteng Shadow MEC of Health, is giving us on-the-ground perspectives at Gauteng hospitals. The Zondo Commission on State Capture has been most revealing throughout its processions in as far as the state of our national rail, ports and pipeline entity Transnet is concerned. Transnet's former Chief Financial Officer, or CFO, Anoj Singh, is just one individual who has 2 months ago come forth and testified on the baselessness which has occurred at the state-owned enterprise, or SOE, notably pertaining to the procurement of the 1,064 locomotives, whose costs were inflated by 3 million rands for each locomotive. Subsequent to Singh's relinquishing of his Transnet CFO position was the appointment of Gary Peter to this very post, of which he was also able to present himself for testimony at the Zondo Commission last month to speak on the malpractices that unfolded during his 25-month stint such as the political influence threats and intimidation through verbal abuse by Gupta associates Salim Essa and Tony Gupta. Episodes such as those mentioned above are definitely the reason why the World Bank and World Economic Forum's or WEF affiliated quote Container Port Performance Index 2020 unquote released 2 months ago has shown South Africa's main seaports to being rated the lowest in the world on the premises of performance of income generating services. Such a negative rating is clearly a testament to the barrage of illegalities that are occurring at this SOE, which also included the former CEO Siyabonga Kama, who was dismissed after having been allegedly linked to the state capitalism perpetuated by the Guptas and other former parliamentary cabinet members. State President Cyril Ramaphosa has also taken time in April this year to appear before the Zondo Commission and vowed to have taken actions to curb state capture, including making efforts to dismantling, quote, the network that made it possible, unquote, all the details of which he has, however, delayed in revealing to the South African public. What has confirmed the validity of the Container Port Index's poor perception of the functioning of our docks has been the latest civil unrest, which has caused a premature shutdown of the Transnet Freight Rail or TFR coal export line and led to the postponement of its annual closure for the purposes of servicing the infrastructure. Our economy's investments have taken a great hit from the looting and destruction by citizens, which exposed the weaknesses of our law enforcement and military agencies, of which Transnet is a great facet in their functionality and effectiveness. Besides being a supplier of fuel to our military, Transnet also has an operation agreement with Denel Aviation, who are best equipped to maintain the Augusta A109 aircrafts which are servicing our ports, railway stations and pipelines around the country. Transnet's debacles within the past 10 years have been most devastating to austerity as a whole, as we witness this SOE's wastage of funds on 1.2 million rand breakfasts together with the Gupta-owned New Age newspaper. It was on one of these very 1.2 million rands per breakfasts that the Transnet Freight Rail's former CEO Kama in 2015 was praising the knowledge pool that this SOE enjoys through Transnet schools at different universities, only to have him fired 3 years later for dereliction of duties. National Ports Act number 12 of 2005's Chapter 7, Section 70, Subsection 1 emphasizes the seniority of authority required to manage our ports in that, quote, Subsection 1, the authority may only close a port which is non-viable and after Cabinet has issued a written directive authorizing the closure of such port, unquote. Like our legislation requires, it is the Presidential Cabinet which needs to prioritize the good performance of our ports, and this is further edified by the rating of our local ports by the World Bank amongst other world-leading institutions, which is below those of countries such as Djibouti, the Ivory Coast, Namibia, Tanzania, and Kenya. Caleb Kachalia, Member of Parliament and DA Shadow Minister of Public Enterprises, is stressing the great significance of having Transnet operations being shut down. Thank you.